Welcome back. Eliminating those unsightly varicose veins for women can be very important. Here with more is Dr. Ed Cheriker. Good to see you, Dr. Cheriker.
It's nice to see you, Brian.
Now, when you do have a varicose vein or a spider vein, some of these things can be very painful, can't they?
Yes, they can be quite painful, but frequently, even in the absence of visible manifestations, there are underlying functional issues. And most of these things stem from failure of valves that are located in veins. Ordinarily, these valves allow blood to flow only back toward the heart.
Okay.
But as a result of heredity, pregnancy, jobs that require prolonged standing, to some extent the patient's weight, all of these things can make these valves start to fail. And once that happens, there is an uninterrupted pressure column from the right side of the heart all the way down to the ankle. And this can produce a great many symptoms that actually inhibit the lifestyle of the patient.
Now, is this problem mainly in women? Is that why we're talking about that?
No, this problem occurs in men as well,
Oh, wow.
although in a much smaller number. If we look at women between the ages of 20 and 40, we'll see an incidence of about 8%, and that incidence increases so that by the time we reach women in an age group of over 70, the incidence is about 72%.
Oh, wow.
In men, on the other hand, between 20 and 40, the incidence is only about 1%, 24% between 40 and 60, and then it goes up. But men tend to have much more severe manifestations of disease, such as skin ulceration and skin changes with hyperpigmentation.
Now, just like any other medical problem, it seems like it is more prevalent in elderly folks, but
It is.
it's different for everyone. How do you know if you have a problem?
Well, the typical symptoms that the patient presents with, assuming that they have nothing visible on the skin surface, people who have jobs that require prolonged standing, particularly professions like nursing, teaching, they notice at the end of the day that their legs feel quite heavy, and even more commonly they complain of aching pain. They have a tendency to have to elevate their legs at the end of the day. And the things that go along with that are itching and burning of the skin, restless leg syndrome at night, and a variety of other things like that.
But you can fix this problem, and it's pretty easy, isn't it?
Yeah, it can be fixed. We always try conservative therapy first, which consists of graded compression hose that have to be measured and fitted to the individual patient. Now, here in the Lowcountry of South Carolina, given our climate, many people don't find that satisfactory.
Definitely not in August around here.
Yeah. If we go through a period of conservative therapy and feel then that further intervention is indicated, we're no longer stuck in the days of 20 years ago when the only procedure was vein stripping, which required general anesthesia and at least 1 or 2 incisions. What we use now is an ablative procedure, which approaches the vein from the inside, and I brought along a catheter here just to demonstrate.
Oh, wow.
But
that's tiny.
This is connected to a radio frequency generator, and we pass this under ultrasound guidance up the patient's leg to a point that we measure exactly. And once we activate this catheter, this exposed tip heats up to 120 degrees centigrade, or about 3 times body temperature. That immediately shrinks the vein down and seals it off.
Wow.
It's a walk-in, walk-out procedure. I tell people who stand a lot to take the next day off, but beyond that, they're back to full function within a couple of days.
So you can fix this just that easily?
Pretty much.
Well, Dr. Cheriker, that sounds great. And if you folks have questions, feel free to call Dr. Cheriker or go ahead and make an appointment and get things all fixed up. Well, great to see you.
We'll be happy to see anybody.
All right.
It's nice to see you, Brian.
Good to see you too. Well, when we return